Today, we are diving in the world of dentistry, something that impacts all of us, but something that we often don't think about until we are in pain.
I felt like I wasn't reaching my full potential, and that's when I pivoted to private dentistry. The mouth is the first portal to the whole body.
Absolutely.
So if you can control that one factor, then we've minimized any collateral damage later.
Hello, everyone. Welcome back to Nadia's Lab. Today, we are diving in the world of dentistry, something that impacts all of us, but something that we often don't think about until we are in pain. I'm very grateful to be joined by Dr. Dehal. Dr. Dehal has worked in NHS and now he runs his own private practice in London, both in Marylebone and Kensington, as well as in Dubai. Dr. Dehal, thank you so much for joining me today.
Thank you for having me.
I'm very grateful to have you here, and I have so many questions for you, especially because you're one of the first dentists to come on Nadia's Lab.
Yeah, thank you for that privilege.
Can you tell me a little bit more about yourself, your journey and career up to date?
Of course. So I first graduated in 2017 and I went to Barts and the Royal London Hospital. So, close by in London still. And we worked in NHS when we started off. So did 2 years and was in that, field. I would definitely recommend.
I know the drill.
yeah, part of the process, right?
Exactly.
And I would say anyone coming up the ranks, it has to be done to kind of work through that and to learn a few things.
Absolutely.
And then I sort of pivoted after a couple of years. I was thinking, I need to do more and deliver more because I felt like I wasn't reaching my full potential. And that's when I pivoted to private dentistry.
Absolutely. And you've obviously, like myself, worked in NHS. And how would you compare working in NHS for like a big, obviously, institution compared to having your own practice?
Of course. So when you first start, you just come out of university and you don't really know much because you've only done a certain amount of treatment. And I remember root canals, we barely did like a few, and you're going in trying to tell people I can do this. So it can be a lot, but I think the main thing is you have supervisors with you and it is fast paced.
Yeah.
And the one thing I think I was really grateful for was great teachers at the time.
Yeah.
And at the time was, people management. Because you're still learning the lingo, how to talk to people, patients. And I think that allowed me to become more astute with how I said things and the delivery of stuff. So being in a fast-paced environment, of course, it's high pressure.
Yeah.
But it's how you deal with the pressure and come through the other side.
Amazing. Yeah. And just to confirm, this might be a stupid question. Dentistry, in order to become a dentist, you still need to do your medical school.
Yes, good question.
6 years.
You do 5 years.
Oh, 5 years.
5 years in the UK. And then you have 1 year of training.
Okay.
So you go 1 year of training. That's what the supervisor, as I was saying. And for me, that location, you get posted nationally anywhere, depending on this interview towards the end of the year of your final exams.
Is that like Oreo?
Kind of, yeah, pretty much. And then I was posted just outside of Leicester. So that was the first time I went outside of London. But I think that was great for me because it was in a satellite village.
Okay.
And that had farmers. It had people who, were from all sorts of walks of life. And what I learned was, certain things that they want to try and have private work done quickly. So you can learn a few things from at those moments in time. Yeah. Some people could be just like, I just want to relax and not delve into that stuff. But I think having the communication at that time allowed me to get better after that year.
Absolutely.
And then after that 6th year is finished, then you can choose to, ideally only NHS practices will accept you because it's a common thing where they want 3 years of experience before they take you on board. Okay. So that's something for, other people to see and hear. And then slowly you can do mixed practice. So you have NHS and private.
Okay.
And that's like something which I know in the UK exists because you have them working together in clinics.
Yeah.
So you go in for NHS work and then it's up to you as a dentist to provide the options. Some can be private and now it's just kind of like, how well can you do them? But the issue was time. So I think we all know that as previous health professionals in the NHS, it's just
the time in NHS. I agree. And then what do you enjoy most about your work as a dentist? Like, what's the best part of being a dentist? I know a lot of people are afraid of dentists. So
And it's the first thing it says, like, I hate dentists. I was like, okay. Now I see that as a challenge.
Yeah.
So it's up to me to change that sort of perspective.
Yeah.
So that's a challenge I like. And then the other thing is just the reward of having someone walk out your door completely changed, self-esteem, walking out higher and taller.
Yeah.
And you kind of had an impression on their life.
That's
So
true.
that's
I
quite
think
big for me.
the smile is probably one of the most important features on
Yeah, definitely.
everyone's face,
I think
and
for
it
all
can
of us,
change.
we are always thinking
Yeah.
about it, right?
Yeah,
Here or there.
absolutely.
Yeah.
Okay, so a little bit more about NHS versus private dentistry.
Yeah, good question.
A lot of people are confused about the two and the differences. Could you explain a little bit what the main differences are in terms of cost,
Definitely.
accessibility,
Yes.
what kind of services they offer, and why would you recommend someone to consider one or another?
Of course. So I think NHS is great. You know,
Yeah.
Sometimes we take it for granted, but in this
Absolutely,
country,
I 100% agree.
like I know there are things that aren't great, but
Yeah.
being NHS in this country, we have access to healthcare and dental care, right?
We should be grateful.
Again, that's number one. And then after that, it's like great for remedial stuff, I would say. So if you're in pain, if you need to get immediate access, and maybe you don't have, the cost straight away, then it's great. But things like later on, like cosmetic stuff is, all later. But I think for access to get healthy better is good. But I think, from there, it's kind of tainted because there's only certain materials you can use. And that's where the pressures come in for GDPs, general dental practitioners, and practices. And then I think patients now are changing, though. They know this. They're well educated. And I think the way that healthcare is going, lifespans, longevity, people do want to change to have private treatments.
Yeah.
But it's just kind of saying, we can come in through NHS and you can get the first care you need. But then after that, I think it's always wise to see, what are my full options and then get the best treatment possible.
So basically consult with a private dentist.
I think any dentist, mainly in the NHS practice, which I'll just clear up, like you have a GDP who's general dental practitioner, but mostly they work in mixed practices. So what mixed means is they offer the NHS list for NHS patients, and they have costs of treatment, like exams will be maybe normal fees of £20 to £30. Then you have other treatments, fillings and root canals, which is a band 2. And then you have other treatments like crowns. But those then cover certain things. The crowns can only be metal crowns. If you want to have ceramics, then that's the private area.
Oh, fair.
And that's where things, when you live there, you see this, or you work in that field, you're like, okay, now I need to give these options. And it's up to providing it comprehensively and seeing how the patient in front of you, can afford it, number one. And then ideally, if you continuously see them, maybe in the future they can have that, but I think the first thing is getting them healthy and fit.
Absolutely.
And stabilization for any treatment going forward is key. So if you get them stabilized, good gums, good teeth, no decay, that can all be done it could be NHS or private.
Yeah. Absolutely.
And then go from there.
Amazing. And let's talk about some common dental myths and good oral hygiene.
Yeah.
So, okay, flossing. Do we all need to floss? Yes. Is flossing that good?
I always see the memes and it's just like my dentist comes in, pokes me, and it's like, are you flossing? Yeah. But I think it's more the fact that we want you to just have good regimen. And the flossing is there to make sure you're doing interdental cleaning. Okay. So flossing is just, any dentist will say that because they want to check, are you cleaning between the teeth? Okay. We may brush twice a day. Yeah. Morning before bed. Yeah. But I think a lot of us, can become, we have hard lives. Yeah. And then it's hard to get in between. Yeah. But, if you do that just once and every day, just build it into the regimen. Okay. You're good. So it could be flossing. Okay. It could be interdental brushes. Okay. And even now water flossers. Okay. So that's something new. Yeah. So you have a few things to use. But I think, if you're trying to, if a dentist sees that, this patient is, knows about these things, number one, is attempting to do them, I like to facilitate that. Okay. So I say, okay, now we're doing this. How much are we doing? I'll check in with you and we just keep building.
Yeah.
The same thing like going to the gym.
Fair. You need to
Consistency
is the key. Exactly.
As
Like
we're
with a
talking
lot of
about
things.
earlier.
Yeah.
Yeah.
And some of the most common mistakes people make when it comes to the dental care. And is there such thing as brushing too much or putting too much pressure? Like,
Definitely.
basically that. And also, how often do we need to do our hygiene checkups? Sorry, I have so many questions.
I know.
You didn't expect this.
But we used to it. So the main thing is, when you're brushing,
Yeah.
always manual. I don't really like because you can't really gauge how much pressure you apply.
Okay.
So I always advise any sort of electric brush,
Okay.
which most likely has a pressure sensor on there. So it will flicker red if you put too much pressure. And yes, if you do apply too much pressure, say just with a manual, and you're not adapting how you're brushing, because the weight of the pressure should be of the weight of an orange, is what we normally say. But if you're pressing hard, you don't really know with a manual. Whereas electric will just start flickering and being red because you're like half asleep in the morning, thinking about work. So just flashing red and you're like, oh, okay, now I need to put it on green,
Fair.
So that's a good way to not overbrush, overzealous, so then the gums don't recede. And you kind of maintain good gum health, but also, you're doing a good amount of brushing, not overbrushing too.
Okay. Good.
And then your second question?
I think hygiene checkups.
Hygiene checkup. So definitely, if you're a good patient, every 6 months, just checking in. So biannual. And if there's other things in the background, so gum disease, gingivitis, periodontitis, then there are some remits where, we do want to see you sometimes 4 to 6 weeks, to get the treatment done.
Yeah.
And then from 6 months, sometimes it can be earlier recalls, so every 3 months.
Okay.
So, but again, it depends on the patient, depends on what's needed. So people with diabetes, high risk factor
High
for
risk, they need more
gum
often.
disease, we need to check that. And people with any heart issues, infective endocarditis, things like that would be good to just check.
Yeah.
And 3 months, like, it's an earliest recall, but no harm in checking early, right?
Absolutely. Amazing. And a lot of dentists say that your mouth is kind of the window to your body.
Yeah.
You'll probably agree. So how can you explain, or is there any linkage between gum disease and conditions such as heart disease or diabetes?
Sure.
Like I recently, this was a study in 2020,
right.
But there was the study found the link between gingivitis and dementia.
Right.
And we can't really say that, it's the gum disease, the cause of dementia.
Yeah.
However, a proposed theory, because in a lot of patients with dementia, they found gum disease.
Sure.
It could be that they just forget to keep the good hygiene, right? But it could also be that bacteria from the gums travels to the brain, and there is a root for it. And then that's what then causes the cognitive decline, etc.
Definitely. I think you're right there. And because gingivitis is inflammation of the gums, why does it cause plaque? And plaque and biofilm is such a interesting components of bacteria that you need and some that you don't need, and they all coagulate. And if those gum issues increase, the bacteria increases, more plaque, and then these bacteria have access to your blood flow, and that blood flow is obviously going towards the brain. And things and bacteria do have different impacts on different parts of the body.
Absolutely.
So as you said, dementia and some telltale signs, some even now say Parkinson's involvement in that. So we just have to be really careful, and I think it becomes more apparent when people in your family have these things, and you're like, okay, now what were you doing? Where was it going wrong? And I think you're right. The mouth is the first portal to the whole body. So if we can control that one factor, then we've minimized any collateral damage later.
Absolutely.
And so even diabetes, you can kind of, knock off. My dad has diabetes, so, trying to tell your dad every day is very hard. And it's just getting them, as with all parents, to listen.
Yeah.
But then they slowly do, and they see the benefits.
Fair.
Then you tell them, like you said, there's other issues that can come along. In the future, and we want to just prevent that.
Absolutely. And I think we need to raise awareness that oral health is actually so important, because it impacts other things of the body. And then obviously diet, smoking, alcohol. It's quite clear to all of us that smoking is bad for...
I think now the culture is changing. So smoking, it used to be big, but I guess the older generations above us still have it here and there.
Yeah.
But it's more vaping now.
Oh yeah.
And
is vaping? I mean, I guess there's not much evidence yet.
No, but
is
I have seen the documentaries. I have seen papers and studies.
Yeah.
Where it's hard to say there's a gain. Biologically gain is not helpful, but there's things that can cause fibrosis.
Absolutely.
So
yeah.
if you think about it, it's also drying out the mouth, right? So even if there's good bacteria trying to build up, you perhaps are killing that off. Number one. Number two, it just goes all the way down to your trachea, the windpipe. So that's fibrosing and it's getting really stiff. So then the question is knock-on effects.
Yeah.
Are these patients able to breathe well? And if they're not breathing well, can they sleep well?
Yeah.
So it's all a knock-on thing, and people who can't sleep will have sleep apnea.
Oh yeah.
And then they grind their teeth more. So it's all correlated and interconnected. But as a dentist, these are one of the main things I've been with good mentors learning to ask patients. Like, do you sleep well? Like, do you have reflux at night? Because these will impact the teeth. We'll see signs. But then as a healthcare professional, I think we have to take it up a notch now.
Yeah.
And that's where you become not just a dentist, you become, someone's looking after someone's health.
Yeah, like a full picture.
100%.
And a lot of what you do, I'm guessing, is cosmetic dentistry.
Yeah.
As we said, beautiful smile is so important. And what's some of the most surprising transformations you've seen in a patient's life, or some interesting cosmetic dental procedure? And you've seen, like you mentioned, people walk out taller and they're so much more confident, and often their career improves, their social life can improve as well. But tell me a bit more about cosmetic industry, because I know it's huge now in dentistry, and there's so many different things. What are some things that you offer, and what's your experience so far?
So for me, I have done further training in masters in aesthetic and restorative dentistry.
Oh wow.
So that gives me more of planning the smile around the patient's face and looking at it through facial analysis, right? So it's not just teeth. Like we look at the whole body, the face, and then we start picturing where the pieces of material should go. Composite, could be composite veneers, composite bonding, could be porcelain veneers. But again, we just want to straighten the teeth before we do all this, and we want to align everything into the most optimal position, is what I like to say, and then we can work on it, right? But it's a process. And I think a lot of people who don't realize this, they want to rush to the end, and that's where things go wrong, and I've seen that. But I think one story that really sticks out to me was one of my friends, my sister's friend. Saw him at the gym many times before, and this is back just after COVID, so 2021, I think. And he came to me, he goes, so he's 26 or 24. He goes, Pav, I'm still wearing this sort of, what you call a retainer with a bar. And what he had was missing teeth, but he also had really diminutive small teeth, because if he was grinding, and there was always been small, because no one actually told him that, we need to build them up so then he can have a, good smile. So he would conceal them, and he would take out that retainer before he'd have lunch with his friends, family. So you can imagine he had that from 16 till 26.
It's like your prime years.
Yeah, and I was like, I need to see him and get him in. And my sister's like, you know what? Yeah, I was like, we've got to help him out. So we saw him. We did a little bit of moving the teeth with Invisalign, get into the right places. And then I knew that I could work on this format, and then we kind of craft and curate where we want the teeth to be, or size-wise. So we do all this planning digitally designed. So we kind of show him first, and we sort of get the emotion from him. Does he like this before we do it? And it's all done virtually a little bit, and then in the mouth. So we do want to just obviously, gauge the patient, see what their desires are. And then I think the best way is then we know at the end, you're happy, because we've kind of seen what you want and obviously what I would like to create, but we have to kind of get that, mentality together. So we get that final picture.
Amazing. Was he happier afterwards?
Oh yeah, he was at composite veneers top 12, bottom 12, and he was just going out on dates after. He was enjoying
too many girls.
Yeah.
Playboy.
No, I'm happy for him.
And what do you think about teeth whitening? What are some ways of whitening the teeth, and what do you think about the TikTok trends like charcoal toothpaste? Does that work?
Yeah, it's always good question. This is one of the common ones, but but the whitening that you can get online, again, I wouldn't recommend, because we don't know exactly what the concentration is.
That's true.
So a horror story that I like to tell patients who ask me about the strips. I won't name names of any brands, but there's some strips you can get, right?
Yeah.
And there was a patient who came in to see me, and he said, I've been wearing this strip all the time on the same place, 4 teeth, for about a year. And he goes, the teeth are yellow now, because what had happened was, due to the burning of the acid and from this gel in the strip, it went through the enamel layer into the dentine. So I do say to everyone's got to be careful with this stuff. And also anything you get online, you don't know the concentration could be high.
No, you don't.
So in the UK, we have certain percentages, 16% or less, depends on the type of gel.
Okay.
And I think that's safe for the patient.
Okay.
And that's done professionally with a dentist to provide you a nice, whitening tray, a nice kit. So then everything done safely and you don't come back with any damages or any sensitivity that's, unwanted.
Yeah.
Especially places that shouldn't be doing whitening do whitening. So,
or people doing it at home with all sorts of stuff from internet.
Yeah. And the charcoal stuff. So
yeah,
I think the charcoal, we're going to be really careful because it looks great. It looks great on Instagram and stuff, and TikTok. But the real reason it whitens teeth is abrasive.
Oh.
So in them, they have, little minerals, little particles, which it could be just 1% charcoal, but the rest of it's just something that's abrading the top surface of the tooth.
Oh, gosh.
And then, you want to be careful because enamel is your body's own mineral.
Yeah.
And we want to preserve that, ideally for as long as possible. And if you're brushing it off or wearing it down, at some point,
destroying it.
Yeah, some weakened things in chip in practice. So
oh, wow. That. Okay, so you put me off with charcoal face for life. But if you could give our listeners 3 golden rules for healthy teeth, what would they be? It doesn't have to be 3. It can be less. It can be more. Good.
Everyone remembers things in 3. So yeah, I think number 1 is obviously after brushing.
Okay.
Spit out and leave.
Okay.
Don't rinse with water.
Okay.
So that's something I advocate to all my patients. Right now, the nutrients in our toothpaste are, better than before, and they will actually sink into the teeth, make them stronger. And also, if they're desensitizing toothpaste, if you let it soak into the teeth, they will desensitize for longer.
Yeah.
Otherwise, if you just wash and put like a bucket of water over the teeth or the toothpaste, really, it's kind of counterintuitive and futile of what you've just done.
Okay.
So yeah, spit out and leave. That's fine. Don't rinse with any water after. Okay. Number 1. Number 2, obviously, snacking in the day, frequent snacking. So I know with busy lifestyles, jobs, we always, are impartial. Yeah. But if we come back home from a really busy day, we want a snack. So just, if you can minimize anything sugary or, the frequency of it, just have it with the main meals you have in the day.
Oh, fair.
And like maybe 1 point of snacking in the day, because ideally you want to minimize the sugar attacks on your teeth.
Fair.
And if you're not flossing and things are getting trapped in between, then we'll see decay in between the teeth, right?
Fair.
So just frequency of snacking, going back like the brushing techniques. And also the third thing is, when you're looking for treatment, for good high-end treatment, make sure you go to the right dentist that, you agree with what they do. And just not going for maybe the best rate because end of the day, you get what you pay for. So you got to be really careful with the decisions you make because I have been hearing things, and there's a lot of youngsters who are 18 now and I want to go to abroad to get the teeth done.
Yeah, that's what I was gonna. Going abroad to get a cheaper dental procedure.
We want to definitely do your due diligence. See, you like the vibe of this person, this dentist, and if you agree with what they do, what they produce, see their cases. And then you should make that move. But again, you got to work on this because don't just step on it, because once you change your teeth at 18, then, these things won't last and you have to keep doing that for a couple more times. So you have to be careful.
Yeah, perfect. I love those 3 rules. And is there any best food for teeth or worst food for teeth? I mean, sweets are bad.
Yeah, sweets, of course. Anything more sugary you can have, and dessert with meals is okay.
Yeah.
But like you said, just minimize if you can. Sugar in general, refined sugar, just keep to a minimum. And then the other stuff, I would say cheese. If you have anything like that, really good, healthy, just adding stuff to the layers of the teeth. But it's just, again, your diet, right? So anything that helps your diet will help the teeth, and it creates a nice bacterial layer, and you may just minimize how much harmful bacteria is in the mouth.
Fair.
But again, processed foods, things like that, just stay away from.
Mm.
Because you don't know how much sugar is in them, which is hidden.
Yeah.
So hidden sugar is always the case, and I'm sure you know this
Yeah.
with patients who come and see you.
Yeah.
So, some may say no added sugar, but there's already sugar in there. So, we just have to be a bit more astute, a bit more smart now and just read these labels. But we actually know there's stuff behind the scenes now.
Absolutely. Yeah, people are definitely more aware. And finally, how often should we be changing our toothbrushes?
Yeah. Yeah, fairly regularly. Like, you have a head on the electric brush, so 3 months. But normally in a pack you get 4, so that should last you a year.
Use it.
I know, but normally what happens is you're like, where did I put it? Where's it gone?
You forget.
Yeah. But just have some in the bank somewhere, and as soon as it starts to get a bit more pliable, soft, it's not really going to scrub.
Yeah.
So you're kind of just there, just doing the action, but you're not really getting it clean. So you want it to be, every work or action has a,
reaction.
Yeah, that's it.
Oh my gosh, did I just quote that? And finally, how, if someone wants to get in touch with you,
yes,
because we were amazed by your speech and knowledge in this episode, what's the best way to get in touch with you?
For sure. So you can definitely reach out to me on my Instagram, and we'll book you in, get in for a consultation. But you can reach me in Kensington, Marylebone, and even if you want to in Dubai. So feel free, and I'll normally get to my DMs straight away because I want to get you in and we can chat.
Punctual, doctor.
Yeah. Has to be.
So yes, absolutely. I guess that's what our profession teaches you.
Definitely.
Dr. Dehal, thank you so much for this. It was very interesting. It was very insightful. I feel like I learned a lot. Sorry for bombarding you with so many questions. I'm sure I will be asking you even more questions. I'm very grateful we did this, and I think we busted a lot of myths and answered a lot of questions. But if you guys have more questions, or decided you're finally gonna go for that dental checkup or get that beautiful smile, do get in touch with Dr. Dehal. For everyone listening, remember to brush, remember to floss, and remember to subscribe to my podcast. Thank you so much, guys, and see you next Tuesday as well. Bye.